Welcome to another episode of the Late Aesthetics Show. I'm so pleased to be joined by the fabulous Dr. Sarah Jenkins today. So you have over a decade of experience in both the private space and the surgical space as well. And you are a leading health expert, or health doctor, I would say, and expert in women's health. And women's health is a topic that we have not spoken about so openly for so long. And I think it's such a topic that we need to educate on for sure. So thank you so much for joining me today.
Thanks very much for having me and inviting me along. It's a privilege. Thank you.
You're so welcome. So take me back to the start. Tell me about how your career started and what you kind of gained from having an interest in women's health specifically.
Sure. So, medical doctor by background. So Cardiff University, and then stayed in Wales for a while and started doing surgical training in Wales. And then unfortunately got divorced and had 2 little children. So me thinking, right, how am I going to manage this life change? I was like, okay, I'll go and be a GP because that's supposed to be family friendly. So I applied to GP training, got in straight away and got offered a job in Somerset. So relocated to Somerset, started GP. And then all these women, because I was female GP, were coming to me saying, I've got this problem, I've got that problem. It hurts when I'm having sex. I can't hold my bladder anymore. I can't do this, I can't do that. And I was just like, whoa. I didn't even know about it. Like, remember, I was like early 30s then. I don't even know anything about this, or I'll do some swabs. Maybe you've got thrush, maybe this, maybe that. But really had no clue because when I was in medical school, menopause wasn't taught.
Really?
Wow. And for GP training, it still is not compulsory to this day that GPs go through women's health training specifically. You don't have to do obs and gynae. You don't have to do any women's health specific training. It's not compulsory. It's all optional.
Wow. Okay, that really does set the scene.
So I was there as a quite normal, down-to-earth woman, actually genuinely wanting to help my patients. And I was like, I haven't got a clue. So I started to research and I started to look into, what is available for women. But also at the same time, because I was doing a lot of ENT, I was already using Botox and doing facial aesthetics and things like that anyway. And then a colleague of mine invited me along to work in his clinic, and he found the Empower RF and bought that machine from InMode. And it was just absolutely fantastic. So that, I started getting involved with InMode, and I also started getting involved with Dermafocus and also Nuvia fillers. And started doing loads of research, traveling around the world, going to Italy, going to the Middle East, going and seeing how doctors do things differently in other countries, and learned a lot. So now I've got all that knowledge underpinned that I'm trying to be an advocate for women to improve the help that we can get available. With the NHS, that's the long fight, unfortunately, but I'm very much campaigning to raise awareness within the aesthetics industry, because as doctors and nurses that have already gone through general medicine can learn all these things. There's no reason why we can't. And I don't know if you saw in The Guardian a few weeks ago that over 750,000 women are waiting to be seen by a gynecologist for a non-cancerous problem.
Wow.
We can be taking up a lot of the flack.
Yeah, exactly.
And we can be helping women and presenting solutions that aren't in NHS guidelines. And the reason, in my opinion, why they're not in NHS guidelines is because we're so far behind the rest of the world because of funding.
100%, absolutely.
Yeah. I'm not going to be popular saying that, though.
You're not, but it's true.
Yeah.
It's true. It's a sad reality where you think we live in one of the most civilized countries on the planet, and yet when it comes to our actual healthcare system that we all contribute to on a monthly basis, we still haven't got access to the things that we really should have access to.
Yeah.
And it's not just about using the NHS when something goes wrong. It's about being able to tap into a healthcare system that actually looks after your health from a young age to be able to prevent certain
preventative
things.
medicine. Absolutely.
Absolutely. I mean, it starts at a young age, and the education from a schooling age, especially when it comes to women's health. I mean, when I was at school, there wasn't really anything about women's health.
No.
You were taught about sex, safe sex, etc., etc. But you weren't really taught about women's health, what to expect, like going through puberty, what to expect when you get to your 20s, 30s, 40s.
100%.
You're not taught that, so it all starts.
I didn't even know as a doctor. So how is anybody that's not trained medically supposed to know or supposed to understand or even know where to get accurate advice and information from?
Yeah, exactly. It's completely agree. And I think that women's health is obviously such a broad and evolving field, which is amazing. We're actually talking about things like menopause. We're talking about things about sexual health now for the first time in a long, long time. What key areas do you think that women need to be made aware of? And let's say, what do women need to be made aware of in terms of what's available for a different age groups as well? Because that's important.
That's a super good question, because actually the Department of Health did a research project where they asked over 100,000 women in the UK what their thoughts were about women's health in general when accessing healthcare. And over 60% of women said they didn't know enough about their periods. They didn't know enough about gynecological symptoms like cancers. They didn't know enough, like over 42% wanted to know more about menopause. These are all things that 100% of women are going to go through.
Yeah, you can't avoid it.
So it's absolutely bonkers to me that we haven't got a healthcare system or a solution in place to start to address these questions that women have. So let me just put it in context, though, because obviously we're living longer now.
Yes.
And we are educated and we are demanding healthcare equality. So say, for example, if a male has erectile dysfunction, there's been Viagra available and many other brands available for a long time. But if you've got female sexual dysfunction, it's not being classified or acknowledged or even accepted. It's just, we've been gaslighted, you just have to deal with it. But actually women now, because we've taken our place in the workplace, because we've demanded equality and now our culture has changed, that we've got top level women that want to quit their jobs because of menopause and they're speaking out.
Yes. Yeah, because they think that they can't function.
Yeah, you can't function.
At the same level.
You actually can't.
But there must be interventions that to take place to allow a female going through the menopause to still be able to function at that high level,
Well, assist or make reasonable adjustments for. So, I'm into body identical hormones. I think personally that's the best way forward, because you do serial blood tests, see where the woman's at, and then match the prescribing with what their body needs, and go from the symptoms as well. But yeah, you're absolutely right. Women, we used to die earlier, women used to die from cancer, but now we're surviving cancer. And if you go through any kind of treatments like chemotherapy or radiotherapy, that majorly affects your skin. And it also majorly affects your intimate area, which isn't spoken about. But if you speak to any of my colleagues in gynecology, they'll say, I would love to help you, but on the NHS, I can't. But you know what? You're cancer free now. Sorry.
Yeah.
So there are solutions, though.
Yeah,
there are solutions.
So let's say, I'm turning 30 this year. So tell me so let's say somebody who's like leaving their 20s, going into their 30s, when it comes to their like female health, are there any key things that, we should be doing?
Absolutely. Collagen. So from 31 onwards, I believe, some studies say younger, we start to lose 1 to 2% of our collagen every single year after our 30s. So if you've got if you're taking a good collagen with good bioavailability, and you start collagen banking, that's what I recommend all my patients do. And that will just help prevent wear and tear in your body. So we're talking about skin, we're talking about gut, we're talking about joints, we're talking about hair, everything. Like collagen makes up everything. So absolutely look after your collagen.
Any specific collagen? I mean, look, there's so many different collagen supplements, powders, drinks. It's confusing. So is there any specific one that you would recommend?
I personally use one by it's called KLW.
Okay.
And she is a fantastic nutritionist who's also a colleague. She's currently doing a PhD to rewrite nice guidelines to address lots of issues to do with nutrition. And so she's formulated these products herself. So they're KLW products. You can buy them off Amazon. You can buy them from her website directly. But I specifically like those ones because I've got quite sensitive gut. And a lot of the others have got preservatives in there that actually can flare up menopause gut symptoms. So that's why I use that one.
And it's working well for yourself and your patients as well.
Yeah, absolutely.
What age do you think that women should start thinking about their ultimate health?
As soon as you're aware of it.
So you can walk and talk with me.
I think with all of us surviving longer and living a better quality of life, you absolutely hit the nail on the head earlier on with preventative medicine. Have a good diet, drink enough water, get enough sleep, educate yourself, but also listen to your body, get to know your body, get to know what you need. Make sure you're taking your multivitamins, make sure you look after yourself, get your vitamin D levels, get your B12 levels, get your iron levels looked at. You're not going to get this with your GP, unfortunately, but I think it's worth investing, from your mid-20s, from, whenever you feel like, right, I'm ready to start having a family, or right, I'm ready to start pioneering in my career now, or really forging my way forward. That's when you should start thinking, right, I also need to invest in my own health. So I've got a good life projection.
Yeah, exactly. And I think we're quite bad in the UK. We work. Whereas whenever I go to Europe, they still work, but they're not killing themselves working. They're still enjoying the lifestyle. And it's about having that balance, which is so important.
Yeah.
And we work in, I would say, arguably a health-driven wellness industry where we preach a lot of the time, but we're so busy that we sometimes do forget ourselves, and we do sometimes neglect ourselves.
Yeah.
So prioritize yourself, definitely.
100%. And remember, what you put in is what you get out. So, if you're putting junk in, you're gonna get junk out. You need to be thinking about, right, is this containing antioxidants? Is this containing micronutrients? Has this got nice macros? Has this got loads of vitamins? What am I consuming ultimately?
Your body is a tool. Give your body the nutrition and fuel that it needs, and it will use that to its advantage.
And for us women as well, I personally think that's a form of self-love. By eating well and taking care of yourself, because we always put ourselves down to the bottom of the pile and everybody else's needs come first. So I actually think by making good, healthy choices about what goes in is a good way of taking care of yourself and living yourself.
I agree, definitely. Menopause, we've touched upon this, is now it's spoken about for sure. Well, there's still a lot of misconceptions around menopause. From your experience, what's the biggest misconception when it comes to menopause?
That it's all just about the hot flushes. So menopause, perimenopause can present in so many different ways. And there's some fabulous websites that women can go to and men can go to educate themselves, to try and understand, right, what my partner's going through this, what the hell do I do? How do I deal with it? How do I understand it? So menopausematters.co.uk is absolutely fantastic to look at. It's got symptom checkers. all sorts. So it can be fatigue, joint pain, migraines, sleeplessness, mood changes. So I knew that I was perimenopausal afterwards with hindsight because I couldn't drive my car.
Wow.
I had like major car anxiety, and anybody that knows me knows that I love my cars. Okay. Like I will happily take cars out on a racetrack and throw it around.
Yeah.
So for me to get in a car and be tearful and have like crippling anxiety, I knew something was wrong.
Yeah, that's not you.
No,
Yeah, exactly.
no.
Yeah.
So, this is why women feel like they're going crazy when they're not. So yeah, it's not just all about the hot flushes.
Yeah, exactly. But there's a big misconception about that.
Yep.
Are there any specific preventative steps that you would advise a female to take as they age?
With what regards
For
for
anything, like if you were to give them, let's say, a few like life pointing tips, what things should they be doing whilst they're aging?
So the biggest thing I hear all the time is I don't want HRT because I want to be able to do things in a natural way. And again, I love my patients dearly, but this is a misnomer, because if your body cannot produce the hormones that you need anymore, give yourself a break and take something that's actually going to replace the loss. And the quicker you get on board with that and kind of discover what it is that's missing and get it treated, the better you're going to feel in the long run.
Yeah.
So holding on like you've just got to get through it and pass through it is a complete misnomer, because yes, you'll come through the tail end of your estrogen and your progesterone falling, but you've got the rest of the physical symptoms with your brain, your guts, your bone, your whole of your body as a female has estrogen and progesterone receptors everywhere. So you have to think about your long-term health, not just the fluctuating hormone levels.
Sexual health is quite often seen as a very taboo subject. We are openly speaking about it a lot more, especially as women, we are talking about it. And it's such a vital part of our overall well-being. It's crucial. Like we need it. Like we just need it. Do you know what I mean? So how do you help your patients feel comfortable when discussing sexual health?
I think it's really important to know that your practitioner, your doctor or your nurse, or even your pelvic health physio is somebody that's not judgmental. I'm not there to judge you and your lifestyle choices. I'm there to help you manage symptoms.
Yeah.
So, I don't care how many sexual partners you've had. I don't care, is just giving that woman the safe space to open up and communicate, right, this is what is going on with me and this is what my ultimate fear is. And, I've learned good consultation skills along the way. And that's probably from my GP training, because, you have to learn how to tease things out of people. Women are really worried about losing their partners, their long-term partners, because they can't have sex anymore, because it's painful, because of the menopausal changes that they've been through. But if they can't feel comfortable to come and tell me that, what kind of doctor am I?
Yeah, exactly.
So we've
How
got
can you
to
help them as well if
Well,
they don't tell you the information?
Exactly, absolutely. So yeah.
And you offer some absolutely fantastic treatments in clinic, which I do think are very specialised. I don't think every single practitioner should be doing them. I think that you have to have a specialty, you have to have a certain skill set and an experience with doing them.
Yeah.
So you offer things like the O-Shot and Empower RF. So talk me through those treatments. How do they typically work?
Yeah. So the O-Shot was a revolutionary treatment where a gynecologist from the States decided, right, well, these other doctors in all the other areas are taking PRP and exploiting its healing properties. I wonder what it would do for women. So he started injecting it into the clitoris and into the G-spot and around the vulva, and noticed that it helped a lot of women maintain their ability to reach a climax, and restore their sexual rejuvenation, restore their sex drive, but also reverse some of the symptoms of vulval atrophy. And also we've realised now, I went to a conference in Barcelona not long ago, all across Europe, thousands of women are being treated with injectable PRP into their vulva to treat lichen sclerosis.
Wow,
and it's
okay.
absolutely fantastic. If people don't know what lichen sclerosis is, it's a bit like having really bad psoriasis or eczema on your labia, and it can become precancerous and turn into cancer.
Wow.
But it's debilitating.
Yeah.
It's like if you imagine seeing someone that's got huge psoriasis on their hand and how excoriated and painful and uncomfortable that is. Imagine living with it in that area.
Yeah, exactly. It's a very intimate area.
Yeah.
And Empower RF, you've been doing that for quite some time now.
Yeah, one of the first in the country.
How does it work then? So
the Empower RF is the actual platform. So it's a machine by InMode, and there's lots of different devices on that machine. So you've got the tone for abdominal muscles that brings your muscles back together after you've had kids.
Yeah.
You've got the V tone, so that directly is electrical muscle stimulation that goes into the vaginal canal and works your whole pelvic floor. Does 30,000 Kegels in 30 minutes.
Great.
You've got the Morpheus 8, which everybody knows and loves. And as soon as I start talking about Morpheus 8 for the vulva, they're like,
it hurt on my face. What's it going to be like, obviously, down there?
So I've been treating patients simultaneously, face and vulva, and they all say that the face is 100% more worse.
Seriously?
Seriously.
You must apply topical cream, right?
So on the face, I do a full nerve block.
Okay.
For the vulva, I just do topical.
Yeah.
And the women tolerate the vulva and internally much better than the face.
Well, if you think we do tolerate childbirth.
Yes,
So,
absolutely.
Surely a bit of Morpheus.
But remember though, on your face, you've got your trigeminal facial nerve coming through, and it is painful, you know.
But the results are fantastic from it. Really, really great.
And the last one that I love doing from the Empower RF is the Aviva handpiece. Okay. So it's a bit like Accutite or Face Tight. But I can do a really, really good non-surgical labiaplasty with that, with very little downtime and fantastic results.
Fantastic.
Yeah.
What are some of the most common intimate health problems that you've seen women come to you and ask about? And what advice would you give any listeners that, let's say, are suffering in silence?
Yeah. So the major thing that women come to see me about is their urinary leakage. So I don't like using the word incontinence because that just drums up the idea of an old lady in a nursing home having to wear a huge pad. If you leak 1 or 2 drops of urine and that you can't control it, or you don't know that you've done it, or if you have accidents, you've got incontinence, unfortunately. And it's so common, and it doesn't matter whether you've had children or not. All women can suffer from it because our urethra is so small. And also, the pelvic floor can really be affected by anything. So if you cough, you jump, you sneeze, and you leak urine, that's stress incontinence. If suddenly you need the toilet and you just can't get the key in the door quick enough, or you just can't get to the toilet, can't undo your trousers quick enough, that's urge incontinence.
Okay.
So those are the main things that women come and see me about. And then once they develop the trusting relationship, that's when they start opening up about, actually, I've got female sexual dysfunction. I've not been able to enjoy intimacy for years with my partner.
Yeah.
You know, I used to be able to have an orgasm, but now it just disappears.
Yeah.
You know, so all these kind of things, women do begin to trust you and do open up, and it's great to be able to offer solutions for it.
Well, what are the solutions? What are your go-to treatments?
So my go-to treatment is PRP with Morpheus 8 V, and I also love vulval filler because it restores a lot of the volume loss. Yeah. So women don't know, like, when we lose this fat here in our face, you know, it's the soothe that we inject into. It's very similar happens in our labia majora. And that's why we get uncomfortable and we get chafing and it starts to get drier. And there's lots of problems. Like, I see so many cyclists and horse riders that can't do their hobby anymore because it's just painful down there.
Exactly.
So you just augment it with some filler and it rehydrates the area just like it would in your lips or on your face.
Exactly.
And it's game-changing, life-changing. And then you've got the polynucleotides as well, which again is really good treatment for women that are perimenopausal, menopausal, that don't want to go and have the Morpheus 8V or something like that.
So I've had polynucleotides around my eye area. What other areas of the body can you inject polynucleotides?
Well, I inject them into the vulva.
Yeah.
So there is a
It
specific...
stings a lot around the eye area. So, like, it stings. Like, so is it the same in more intimate areas?
Again, like what we were saying with the face, your face has got so many more nerves than the intimate area does. Okay. And I have specifically made tetracaine that I use in the intimate area, and it is very numb, and most women tolerate it very, very well.
And do you need to have multiple sessions as you would, let's say, with the face?
Yes, so it's 5. The protocol is 5 sessions. So.
And what's the concept behind injecting polynucleotides in a female's intimate area?
So exactly the same principles as it is with the face or anywhere else on the body.
Yeah.
So you've got those highly purified DNA fragments that are there. So you inject it into the skin. It helps your body replenish the pool of DNA that it's rewriting and replicating itself from. You've also got the hyaluronic acid and the mannitol in there as well, which helps to hydrate the area, plump up the skin, and it all encourages, the fibroblast activity. So it produces more collagen and elastin, and also tackles the replication with your DNA as well. So it's two-way double whammy.
Can you do the polynucleotides in combination with PRP?
Yes. I do everything in combination because it's But same as the face, what are you treating? You have to think about the different layers. So we've got the skin, we've got the fat, we've got the muscle. You've got ligaments. You've got everything there. So for toning, for doing the muscles, like M-Face, like any of the other InMode devices, you can do the muscles with the V-Tone or the M-Seller. I prefer the V-Tone, but that's my preference. Then you can do the skin with the polynucleotides, with the microneedling, with the PRP, and you can also address the skin with polynucleotides and there's even growth factor serums and things that women can take home and use in between treatment.
No doubt.
Oh, my friend Devil. But I do love his growth factors.
Using it for a while.
And in all honesty, I do recommend that my women use them on their intimate area as well. So I know that's off label, but it's fine.
Yeah. I mean, growth factors. So we know that lifestyle plays a huge role in both male and female health, really.
Yeah.
Are there any simple daily habits that you recommend to your female patients, what they should be doing every single day when it comes to their lifestyle?
Pelvic floors.
Like actually doing the physical exercises?
Do your pelvic floors. Okay. So I would recommend buying a home device to do your pelvic floors that feeds back to you whether you're doing them properly or not.
Okay.
Because you can do them, but then you cannot relax the muscles properly.
It's like any muscle.
Yes.
Yeah, you've got to obviously let it contract and then
exactly. Yeah. So just like you would go and see, what do you call them? The brain block. Thank you. Menopause. Just like you'd go and see a personal trainer to get feedback about how you're working your muscles properly and how to improve your running technique.
Yes.
You need that feedback about, am I doing my pelvic floors properly?
Yeah.
Because if you don't relax the muscles properly, that's when you get hypertrophy of the muscles at the interoitus, at the entrance to the vagina. And that's when you can start having painful sex because you can't relax those muscles enough.
So you can overdo it.
You can overdo it. And also women that have experienced traumatic childbirth or any kind of trauma in that area, they have really tight muscles as well. So we use Botox to relax that.
And is the Botox, is that painful?
No,
or?
It's just one injection each side.
Relatively straightforward, yeah. We've mentioned about self-care and we've mentioned about women, they should prioritise their health. and themselves, because sometimes with families, with partners, with a career, we just sort of bypass ourselves and think, oh, we'll be fine.
Yeah.
What are your top self-care tips that you would give to any female?
Listen to your body. Just absolutely listen to your body, and don't let anybody dismiss your symptoms.
Yeah.
Learn to advocate yourself and arm yourself with information. So if you are not feeling right, listen to your body, stop, and keep a diary of your symptoms. Because if you're going to go and seek medical help, it's really useful tool to say, right, on this day, and it was this part of my cycle, this was happening. You know, your GP or your medical professional is not a mind reader, and we can do every test in the world and still not get to the bottom of what's going on for you. But if you listen to your body and you find a good practitioner that listens to you and is willing to work with you in a good doctor-patient relationship, then, you know, help them help you.
Yeah, definitely. So we'll go through some fun questions.
Okay.
Not that any other questions haven't been fun. But I'll give you like a one truth. Well, it's a myth. Well, you need to guess whether it's true or false, basically.
Okay.
Or, well, not guess, but use obviously your scientific brain to tell me. So is hormonal imbalance inevitable as we age?
Yes.
And what can we do to fix that?
So again, listen to your body and advocate for yourself and get the tests that you need.
Okay.
Even if it means going privately.
Well, we probably need to go private. Yeah, definitely. If you could give one key bit of advice to your younger self, what would it be? Regarding your health.
That's a difficult one.
Is there anything that you do now that you know now that maybe you didn't know, let's say, in your early 20s?
Oh, absolutely. I didn't know anything about menopause. I didn't know anything about collagen banking. I didn't know anything about NAD. You know, these are all new things, like the whole menopause kind of revolution that's been going on in the last 3-4 years. Thank God. You know, that's what I would tell my younger self. Like, just don't get freaked out about it. Don't worry about that everyone's talking about it. It's not as bad as you think it's going to be, as long as you're prepared for it and we all talk about it and teach each other about it.
Yeah. Prepared for it both mentally, but also from a point of these are things that you can do to really, really help that. And it should just be viewed, it's a different stage in your life.
Yeah, absolutely.
It's inevitable. It's going to happen, but it's just a different stage. It's like a different chapter in your life, pretty much.
If you listen to Sunita, she says now she's having the best sex and best time of her life now that she's post-menopausal. So.
There's quite a few women that do come out and say that, actually. Yeah. But also maybe they're older, so they know what they like, what they don't like.
Absolutely. It's actually, we shouldn't see aging for a woman as a negative thing. Like, men become more distinguished and refined, and, you know, they've got so many good positive connotations, whereas women are, well, you know, our ovaries are shrunk up now, so we're not any use anymore. Yeah. Well, no, actually, I want to be dignified and refined the older I get. Thank you very much.
Well, but even look at society. Like, it's changed now. Like, before it was normal in your early 20s to settle down, have a family. But now it's becoming more normal for women in their early 30s to start thinking about that and working on their career through their 20s.
Or late 30s, like
exactly.
me. Yeah, absolutely.
It's not that your whole reproductive system has been shut off as soon as you hit 30. Like, we were taught that, though. Mm-hmm. You know, we were taught after 30, that's it, it's the cutoff. But, you know, 30 is the new 20 now, definitely.
100%.
Yeah, 100%. What is the biggest misconception someone has when it comes to sexual wellness?
That women don't have to enjoy sex.
Yeah. That's a big misconception, definitely.
I'm all for equality. And you know what? If you're... you know, engaging in consensual enjoyment or consensual procreation activity, why should you not be enjoying it?
Yeah, exactly.
And I'll leave it there.
Sure. Let's move on to wellness treatment. Is there any specific wellness treatment that you think that everybody should try at some point?
I do love NAD.
Yes.
I do, like I was saying earlier, it's all about what you put in, you get out. I just think just take care of yourself.
Yeah.
Just take care of yourself. Yeah.
Yeah, definitely. Women's health, as we've mentioned, is exciting. It's evolving. Is there anything that you are excited about that's maybe new coming out in 2025 that you're bringing into the clinic, or any new research that you've maybe been involved in?
So the polynucleotides, the intimate polynucleotides, I've been involved with that. The only one at the moment that we can use on license in the UK is the dermafocus new gynae. So that has been around for a good few years now, and myself and Samita and another lady, I can't remember her name right now because my menopause brain. The three of us were trained by the people, Mastelli, that invented it.
Oh, great.
So I've been using it for quite a while now, and I think it's got a really good potential that's going to be good for any woman.
Yeah.
So yeah, watch the space on that one.
And it's not going to do any harm whatsoever either.
No, it's hyaluronic acid stabilized with DNA fragments.
Yeah.
So it all gets reabsorbed. There's very, very low issues that have been reported. I mean, they've been using it for over 25 years in Italy.
Yeah. It's just we are behind.
We are very, very
behind the
behind.
times.
And exosomes. I mean, exosomes I'm still very much on the fence about, but I'm desperately trying to learn more. I'm talking to my colleagues that are a bit more clued up than me because they're plastic surgeons or professors.
Yeah.
And I'm really looking forward to what's going to be coming out about that.
Exciting space, definitely. Really exciting space. And what do you think that the future holds for women's intimate wellness and sexual health?
I think that women are going to get a lot more clued up, and they're going to demand equality, and why shouldn't we? Mm-hmm. So I'm really excited that there's so many more of us female doctors now that are on board with not dismissing this anymore. So women, after they've had children, can go and have rehabilitation on the V-tone, and women that are perimenopausal, menopausal can have Forma V or Morpheus 8V, have the O-shot, have polynucleotides, have fillers, and not suffer in silence. And especially women that, are having urinary problems, recurrent urinary tract infections or candida or lichen sclerosis, because all these energy-based machines are coming out and we're using them in combination. Mm-hmm. I'm very happy and confident that we can find a solution for every woman. We might not get you 100% perfect like you were in your 20s, but that's unrealistic. That's like saying, give me a facelift to make me look 25 again.
It's true. Yeah, it's true. And again, we evolve all the time. We do get older, but it's about getting older in the most healthiest way that's for your body. And that's
absolutely
what it comes down to.
And because we're talking about these things, and because we're highlighting it, and because more and more doctors are getting clued up to the fact that this is what women want and need and are asking for, we're getting trained and we're finding solutions for them. So it's actually a really, really exciting time. Yeah, definitely.
So we'll do a quick fire round, and you just tell me what's the first thing that comes to your mind. What is your go-to morning ritual?
I use Deb's growth factors. So I do painless peel, and then Deb's growth factors, vitamin C cream, and then I'm using Nuvia C shot and Nuvia's restorative care cream at the moment.
Oh, great. We should also make a note. We should rename Dev's GF5 just Dev's GF5.
Sorry, it's Salderma GF5 before he gets into trouble.
This is the Salderma sound.
I know.
Okay, you might have to come up with a different answer for this one. What's one skincare product you can't live without?
I cannot live without. Okay, vaginal moisturiser.
Oh, okay. I didn't realise that was a thing.
Yeah, it's skin. We moisturise everywhere else.
We do. Okay. Any specific brand?
I get one from Italy when I go over, so sorry.
Can't name that. Yeah. What's the best piece of health advice you've ever received?
Listen to my body.
Yeah.
Listen to my body and know the symptoms. This quick fire. Sorry, I'll stop.
What's a health trend that you think is overrated?
I don't know, because all health trends are, as scientists, everything is a working hypothesis until it's proven or disproven in another way. So
it's tough. It's a tough one.
Yeah.
What's one treatment that you'd recommend to all women?
Morphocyte.
Anywhere on the body.
Anywhere on the body.
Great. And what's one thing that you wish every woman knew about their overall health?
Again, what menopausal changes are, particularly to your intimate health. So inform yourself about genitourinary syndrome of menopause.
Okay. And where can our listeners connect with you? How can they book a consultation with you to find out more about your services and to see whether you've got something which will help and improve their lives?
So my main practice is at the Door W4 in Chiswick. And so they can contact via the website or they can phone up. You can catch me on Instagram, so dr.sarah.jenkins on Instagram.
We'll this as well.
Fantastic. And I'm also working with a lovely little clinic, Umi Clinic in Petersfield as well.
Oh, lovely.
So there's lots of different places, but my main practice is at in Chiswick at the Door W4.
Fantastic. Sarah, thank you so much for joining me today. It's been so insightful and we've covered topics that need to be spoken about a lot more. So if anyone has any comments, put them in the comments section and don't
Be nice.
subscribe. Yeah, be nice. Yeah, you can't take people aren't nice. But put the nice comments. The other ones will just get ignored. But yeah, thank you so much. You've been a brilliant guest.
Thank you. Thanks.
Thanks.